I'm the current president of the Minnesota Medical Association, an organization that represents over 10,000 physicians in Minnesota. As president, I personally have been made aware of the presence of ICE agents in our hospitals. I had a report of a detainee in the ED with injuries inconsistent with accidents. I also had a report of a vulnerable adult who didn't have a caregiver with him to help him make important medical decisions. There are reports of ICE agents refusing to leave the room for private exams or while patients are getting bed baths. There are also reports of staff experiencing rude and harassing behavior from ICE agents. Their mere presence in the emergency departments make a difficult job even more stressful for all the staff, thus interfering with patient care. We also know that people are not going to their regularly scheduled doctor's appointments, as was mentioned. This is adults as well. They're not leaving their homes for work or school. They're not picking up their prescriptions or getting their vaccinations. And they're not obtaining healthy food for fear of being detained by ICE. This means that acute and chronic illnesses are not being managed properly, and it increases the likelihood that these individuals will end up seeking emergency care. Preventive care is always better and cheaper than waiting for an emergency to arise. We're also concerned about the indiscriminate detention of anyone with brown skin, including Native Americans, who are the only people among us who are not immigrants. A report by one of the local news agencies last week reported that only 5% of detainees in Minnesota have a history of violent crime. And in the worst of the worst, 7 of those people's only crime was a DUI. Under EMTALA, the Emergency Medical Treatment and Active Labor Act, which was codified in 1986 under President Reagan, all physicians are required to provide emergency care for any patient, regardless of citizenship, legal status, or ability to pay. We also swore an oath to take care of all of our patients with unbiased, respectful, and dignified care. The MMA wants to ensure that all Minnesotans, regardless of immigration status, have access to safe and timely and high-quality medical care, and that ICE enforcement actions do not interfere with that care and undermine the health of our communities.